Okay, today we're going to talk about the Philips Respironic Dreamstation BiPAP ST with AVAPS. In the event you do not have your ventilator of choice, we can take this unit and use it as a ventilator to ventilate someone invasively. So we're going to talk about the machine itself, what it can do, the settings, the circuit, and all those things. So first thing I want to mention, this is actually two units in one. There's a heated humidifier in the back, and it is hooked up to the blower unit here. To access that, just to show, for demonstration, there's a water chamber in here. It sits in place, snaps back shut here. There's a button on the side. If you push this button, or if this thing were to become dislodged, something happened, worst case scenario, you can hook your circuit straight to the back of the machine itself here without the heated humidifier. For the demonstration, we're going to keep everything intact. We'll put these things back together. We are not using the heated humidifier. It is intact though, and it'll work just fine. We have an HME in line on our circuit. So just to break down some of the components of the circuit, we have a bacteria filter. We're going to hook it up to the outlet there. We're going to take our standard 6-foot tubing, place it on the bacteria filter. You will notice on this circuit, we have a whisper swivel in place. So that is an inline passive circuit. It's an inline exhalation port for this setup. If we do not have a whisper swivel, again, this is not a proprietary circuit by any means. It's something you can put together and use as long as you have an exhalation valve in line. You can take one like this. Every department probably has a box of these sitting around. You could use that in place of a whisper swivel. If we had concern that the exhaled air was that we needed to filter that again to going back out into the room, we could put another bacteria filter in line just past the whisper swivel or exhalation port that you have. We're going to place the whisper swivel into our HME, and you see that's a separate piece from the flex adapter, and then we have that going up to our lung, and that's our patient for the demonstration. So we're all hooked up. We are ready to go. To turn the machine on, just simply push the button once. I want to access the therapy menu, so we're going to push it again. So the machine is now off and running. It is ventilating. Based on the settings that I had already programmed to the machine, we'll talk about that in just a second on how to change those settings. As you can see, we have our pressure, leak, minute ventilation, tidal volume, respiratory rate. We're in ST mode with AVAPS, so we have a target tidal volume, and we are getting that volume right now. To go to the next screen, just simply turn the knob. Now we're in our settings. We're in mode right here, and we are in ST. If we wanted to change that, just push the big button, make your change till you get to your desired mode, and then push it again. You'll notice you got pressure control, CPAP, spontaneous, ST in time. For this demonstration, we want ST so we can deliver a rate to the patient. Our AVAPS feature is on, so we can dial in a target tidal volume. And that's exactly what we want right now. So AVAPS is on. Go to the next setting. Obviously, here's our tidal volume. To make a change, push the button. Screen comes up. You can make your change accordingly. You get to your desired target tidal volume. Push your button. Our max, our inspiratory pressure max, IPAP max is here. Right, it's 30. That's the max that we can get. So we're going to leave it there. One more turn of the knob. We go to our IPAP min. Right now we're at 20. Just for the demonstration purpose, we set it at 20. Our EPAP, so that will function as our PEEP. So right now we have it set at 5, just a standard setting of 5. And obviously we can go up with that. You have a spec sheet in your box with on the provider guide. It'll tell you all your limits and what the machine will do by way of pressure setting, etc. We'll talk about that in just a second. Breath rate is set at 12, and our I time, just for the demonstration, is set at 1.8. Next turn, it takes us back to the main menu if we'd like. We're not going to do that right now. We're going to go into our alarm screen. So we've got disconnect alarm, apnea alarm, low minute volume, tidal volume, and then again, we can go back to the main menu. Some of these things I'm not really going to apply to the setting of ventilating someone invasively, but I just want to go through real quick. Just talks about our humidification settings, our ramp settings. This is one that we might use actually right here is our rise time. So if you wanted to make a change to your rise time, just push the button again and make your change. You get to where you like. I'm using the default settings right now for that. You can lock somebody out if you don't want anybody to make that change. Tube type, that is important, just so we know that our values are accurate. So right now we're set at 22. You have 15, you just make the change, push the button, you're ready to go. You can lock people out of that as well. Mask type does not apply. We're not doing a non-invasive ventilation at the moment. We've got the AHI off. That doesn't really, we're not concerned with that right now. Pressure units, obviously, we want centimeters of water pressure. And it shows we have an unlock icon here. So it shows we are in provider mode. What's that mean? It means we can go through as clinicians and make any changes that we want without having to worry about getting locked out. If for some reason you were locked out, you would press the big knob and the ramp button simultaneously. That will unlock the device. You can go in and make your changes at that point. With that being said, I want to show every machine should come with a provider quick start guide, and in that it shows just a breakdown of the machine, all your pieces and parts. It also kind of gives you a therapy settings spec sheet here. Again, it gives you the secret handshake, ramp button and big knob simultaneously pushing down that lets you get into the provider clinician menu. Very, very good, very informative for you RTs out there. We have a user manual for the unit itself and a user manual for the heated humidifier. So we're going to go back to the device for just a moment to show the air intake is on this side. This is the air intake filter, and I believe each box should come with an extra one as well. But that just, let me show real quick. That just pulls out, slides back in, the door shuts down. There's an SD card on there as well. That's for compliance monitoring and your typical home patient, but again, not applicable to this demo. Going to go back to our main menu. You will see our therapy comes up. We can view our actual data going on with the patient. Again, it shows our pressures, it shows our leak value, it shows our actual minute ventilation, our tidal volume and rate. We are ventilating this patient invasively with a passive circuit to turn, and for right now I'm going to show you again how to turn it off. You just push and hold that button, and it's off. That is the Dreamstation BiPAP with AVAPS.